Good morning. This is Senate Health and Welfare. It is 2/22/2022, which is an interesting date for us. And welcome everyone who's here and out there. I'm going to make a quick comment about some bills, and then we're going to move on to H654, which is a pressing issue for us in terms of time. So committee, we've been receiving a significant number of emails regarding S82, which is a bill granting the auditor authority to look at and review all the records of the ACO as well as any related organizations. And I've reached out a couple of times and I've talked with alleged counsel about that bill. And it's my understanding, at least, that the auditor already has the authority to review the use of public funds, state and federal funds within the ACO. And then we'll be looking to see further what the auditor's authority is. So we may bring that bill up for consideration either before or after crossover. It's something that many folks have signed on to, and we don't want to step in the way of that. S158 is a bill that's currently in government operations, and we're hoping to have it here in our committee after crossover so that we can review the scope of practice extension or expansion that's in the bill. So that's it for today, and then we'll talk further about other things that we're working on. But I wanted to have Jen come in and go through H654. We've worked on this bill since we've gotten it, even before we got it. So Jen, I'll just update. I did reach out and talk with House Healthcare, and they would like to see the word shall remain in the two sections of concern, section 6 and section 9. DEVA also indicated that they were fine with leaving shall in the section where they were concerned about it. I forget whether it's 6 or 9. Jen can remind us. So, okay. So Jen, what do we have in H654?
Jennifer Carvey, Legislative Counsel. So we have gone through H654 a few times. That is the bill extending COVID-19 regulatory flexibility. And so I'm not sure what you would like to look at this point. If you wanted to revisit 6 and 9, or if you just wanted a reminder of what is in the bill, which is extending a number of provisions from Act 91 and creating a sort of transition path for telehealth registration, going from the Act 91 provisions to the telehealth licensure and registration provisions that are being worked on in the House in H655.
I think committee, if anybody has a question to ask of Jen at this point about anything that's in the bill. We've been through it several times. I don't feel a need to go through it again. Somebody wants to do that, we can do it. Questions? Okay. So I would entertain a motion. Our clerk is not here. I guess I'm thinking that, Aaron, do you want to keep track and go through the vote? How did we do it last time? Ruth, did you do that?
I think I did it. I'm
okay,
happy to do it.
Go for it. But first we need a motion.
So I move passage of H654 version. What are we at, Jen?
As passed
you're
by
actually
the
just doing as passed by the House.
Oh, yes, as passed by the House, that we concur with the House. So there we go. There's a motion, Madam Chair.
Thank you. All right. So discussion committee. The only thing I would like to say is that should we pass the bill to the full Senate, then I'm going to ask to go through it and then have it put in all remaining stages of passage so that it can get back to the House and to the governor's desk as quickly as possible. So And we
Yes.
I may even ask to pull it off the notice calendar, depending on what the timing looks like. All right. Madam Vice Chair, why don't you
Okay.
call the vote?
Senator Cummings,
Yes.
Senator Hooker,
Yes.
Senator Hardy, yes. Senator Lyons.
Yes.
Great. The vote is 4-0-1, I believe.
Perfect.
And
So
are
I can
you
report it.
reporting
I've reported it 1,000 times before, so.
Makes sense.
Jen, so we can have the clean copy to Aaron. Is this the clean copy that we have?
This is it. It's
All
it's
right.
just what came over from the House.
So what's the process here, Aaron? Then do I send this up with a vote to Senator, Secretary Bloomer?
Yes, I believe so. I will be
That's it.
sending, who is acting as the clerk right now? Senator Hardy, I'm guessing?
Yes.
Yes.
I'll be sending you the record of action to just approve, and then I'll be sending everything else as well to Senator Lyons with the witness list.
Okay,
That's good.
good to know. All right, and then just FYI, Senator Terenzini very much wanted us to hold votes so that he could vote, but I indicated to him that we may not hold this vote because I'm feeling that we should get this one moving forward. All right. Jen, is there anything else? Oh, just maybe a summary at some point, because I think folks on the floor may want to understand what's in the bill. And then that would be it.
Great.
All right. Thank you. What is next on our agenda? All right, so we're moving on to some Katie bills, and yesterday Senator Hooker and I continued our work on 194, 195. I do see that Holly Morehouse is here with respect to 197. And I'm just gonna, I think I just asked Holly for you to make your comments on 197, and then we'll move ahead to 195. Just to, in consideration of the time that you're here.
Thank you, Senator. I appreciate that. I'm happy to be available for questions. So for the record, I'm Holly Morehouse, Executive Director of Vermont After School, and I am incredibly excited about S197 and the possibilities there to help address the crisis around youth mental health and well-being that we're all seeing. I don't think there is any of us that doesn't know at least one young person who isn't struggling at this moment in time. My understanding of S197 is that it's different from the other programs that are out, grant programs to expand access to after school and summer, and those that we're working on with the Agency of Education. Those really are to answer the question of how do we get more programming out there? How do we get more children and youth access to after school and summer programs and all that they offer? I believe 197 is actually answering a different question. It's answering a question of, with the mental health crisis that we're facing with our children, youth, and families, is there more that we could be doing? Are there other spaces that we could be looking at? And are there other approaches? So I see 197 as a way for the after school field to help step forward in a sort of all hands on deck approach. I also appreciate in 197 the attention to the multi-tiered level of supports, that this bill, this program isn't going to step in and solve the problem for the youth that are in crisis in an emergency room at this moment. But what it can do is provide a base level of supports across all children and youth, and then some tiered supports above that with small groups and counseling sessions. I don't think anything in 197 is meant to imply that after school staff or providers would take the place of mental health professionals. I think what it does instead is it provides the funding and training so that the youth development workers and specialists who are in those after school and summer programs actually can do that deep level of collaboration with the mental health agencies and with the local pediatricians and with the schools to further complement and wrap around the supports and services. I do think in times like this, what we're hearing across the state is that families and youth also need more flexibility. I think 197, by looking at those spaces outside the school day and throughout the summer, they offer families and youth additional places and spaces within to access these supports. They also, the list of ideas and supports that are in 197 for the programs also would complement and reinforce and be that additive power on top of what is happening during the school day and in private treatment sessions. I think the last thing I would say is that, after school is an appropriate and in many ways perfect setting to do these type of supports. We have seen after school programs provide supports around mindfulness, social emotional learning. We have seen strong results when they work with social workers or mental health professionals. We saw that last summer in the Summers Matters grants, where they were able to bring staff in, and it benefits all the, across the board, the children and youth, as well as those special groups and the families that are being served by the programs as well. There are other things that happen in after school that is good for mental health across the board. Eating well, being active, being out in nature, having friends, having caring adults, all those pieces. So I think that what this grant program could do is add that added layer of collaboration, bring in those mental health professionals and those connections with mental health agencies and pediatricians in the schools, and provide that broader swath of supports. I will pause there and see if there's any questions you'd like me to answer, or if you'd like me to hang on in the background in case further questions come up.
Questions committee for Holly. Go ahead, Senator Hardy.
Thank you, Madam Chair. Thank you, Holly, for being here today. In looking at S197, it requires a lot of these programs, and it's a very little amount of funding. So either you're going to fund a few programs at a higher level or a lot of programs at a level totally inadequate. So how is this actually going to impact? How many kids is this going to actually impact, and where are those kids?
Thank you, Senator. Our hope would be that there would be enough funding to substantially support the program so that they could meet all of those requirements. When I look at those requirements, those are the pieces that I see would need to be in place to really do this well, using evidence-based strategies, making those connections to the mental health professionals in the schools, supporting families, creating those activities. I think that two things. One, I would see this as a grant that would go to an existing after school or summer program on top of their staffing that's already in place to do some of these pieces. I would see it as a way to hire perhaps a designated individual. That's one of the things that we've seen them do. So for a $75,000, $100,000 per program, to hire someone who is the point person around the mental health supports and interventions, and is helping to build those collaborations and connections that we've been talking about, and to ensure that the data is there, to ensure that the families are in place, to ensure that the programs and the interventions are running in those spaces. So that would be my best guess, at about $75,000 to $100,000 per program to pay for that kind of support, collaboration, training, and position. Could go a long way. And I do think that after school programs are nimble and flexible and can do kind of folks. I think that that level of grant funding would let them do the job well, which is something also that they have a deep commitment to. So I would advocate for increased funding in the program over the $250,000 that's currently in there.
So at 250, Madam Chair, I have several.
Yeah, go ahead. No, go ahead.
If I may. So at 250,000 at 100,000 each, this is, you know, maybe two, maybe three programs, maybe. So for hiring one person to coordinate all of the many, many things that are on the list that they need to do. So the impact of this would be quite small.
So I guess
so-
I'd like to, go ahead, finish. I thought you were finished.
No, I'm asking Holly for information. I'm trying to understand the impact of this program. There's such a need out there that I want to make sure we're getting the biggest bang for our buck. And while this sounds really great and ideal in an ideal circumstance, it doesn't sound to me like it's going to impact that many kids. And so I just want to make sure that we're spending our money as wisely and effectively as possible, given the crisis that we have out there. And so help me understand why this is the best way to spend this $250,000.
I'd like to just make a comment and then I'll turn it over to Holly. So as we know, this bill is going to continue its trek and the Education Committee will be reviewing it. And I think I indicated last week that I have reached out to Joint Fiscal Office to evaluate the guidelines that exist for ESSER funds, which are really education funds. So Joint Fiscal is going to help us understand the extent to which ESSER funds can help with these programs to increase the amount that would be put into the bill. This is like a little placeholder. We could theoretically, we can change that. We can make it larger. But overall, to make sure that the things that you're concerned about, Senator Hardy, are things where I think we're all concerned about. We want to make sure it's robust enough to meet the challenge that's in front of us with kids' mental health. But
yeah, absolutely. And the ESSER funds are supposed to be used for schools, and I'm sure those are spent 3 times over at this point too. So I guess I'd like to hear Holly's answer to my question about help me understand how this is meeting the needs of the most kids, getting the biggest bang for our buck. Maybe it is. But given that what we're hearing is that the money is already spent over in the House and we're trying really hard to use our money effectively to meet mental health crises across the board, how does this fit into that puzzle?
I think that this proposal works in concert with those other proposals. I think that what it does is it extends the range of services into other times. It pulls in other youth development experts who are working closely with children, youth, and families to help become part of the solution. It doesn't cap, around the school day or around the school year in the same way. It meets families where they are. I think you're right. I think a $2 million investment in this area would go a really long way. And that may be what we need to do. I'm not shying away from using one-time funds, if that's what you were, to choose to do, because I think that the impact would be in that one-time moment in answer to the crisis that we're seeing right now, and the what's happening with children and youth mental health. And I think that the collaborations that are built, those regional connections, the training for staff in this space, the way they're would be working with pediatricians and mental health professionals in a different and new way, that way that they could augment what the school is offering. I think all of that would continue on beyond the life of the grant. And that's what we see with strong programs, right? That when they build that collaboration, that partnership, those pieces continue. And when we see something in the space that really works, people find a way to continue that. So I do think it would be a worthwhile investment, both at this moment in time to do something more and different for the children and youth and families that are struggling, and to build those systems forward, to build those collaborations forward, those longstanding partnerships moving forward.
And how does this relate to, I know there's 4.25 million, I believe, that just went to your organization. How does this dovetail or with that? I mean, if given that there's already that money available, what's the add-on for this?
The 4.25 that we're working on with the Agency of Education is about creating more after-school programs and creating more access for children and youth so that we have those strong programs in place. So when we want to do a deeper intervention, like we're talking about here around mental health, that putting those additional services and supports into those existing broad-reaching programs is possible. In that competition, there are places, areas of our state where there isn't even an after-school partner to be able to have this conversation with, to talk about expanding supports in this way. So that one's really about how do we set up that base level infrastructure so no matter where you live in the state of Vermont, no matter what income your family has, that you have access to after school and summer, and no matter what grade level you're in. This bill that you all are considering today, I see it as saying, how do we address the mental health crisis? You know, how do we do something different? How do we use these spaces that we're investing in and expand those collaborations and those use and so forth. So one for me is about access to programs, and one is about what can this field do? How can they help support the crisis that our children, youth, and families are dealing with right now around mental health and just mental well-being in general.
Mm-hmm. But it would only be in 2, maybe 3 programs in the state. So anyway,
depending on how much funding the general, what you all decided on that.
Okay. Thank you.
Yeah, I'd just like to reiterate that the 250,000 is actually a placeholder until we can explore other funding options. And that's something that I have been in communication with Senate Education about, but more importantly with Joint Fiscal to understand the guidelines around ESSER funding. Senator Cummings has a question.
No. Was this bill referred to us, or is this an education bill?
No, this is our bill.
This is our bill.
Yeah, it's a mental health bill
Okay.
that we had. It started out significantly different, but it's still a mental health bill. And the goal is for us to define the type of mental health support that kids currently need as a result of the pandemic. What we're seeing and what we heard from our schools and what we've heard from others is that kids need mental health support. And so this is meant to provide the programming for those kids. And it's a it's a 2-year grant program. It's not a forever, but I mean, it may end up being somewhat forever. We don't know, but at least right now we're in the middle of a crisis with children, and this is meant to respond to that crisis.
Okay. Maybe I missed something, but I don't remember us taking any, expanded amount of testimony on what the mental health crisis is. I don't doubt that it's there, but
okay,
I don't feel like I've had a chance to understand what it is, what's causing it, who's addressing it, what's the plan. I know that having after school and summer programs, if nothing else, would contribute to the mental health of families by removing the anxiety of what am I going to do with my kids while I'm working and they get out of school at 2:30 in the afternoon. That kind of angst. I know that that after school is playing a vital role, but I don't have any concept of what else is going on. We had some testimony from some people that work with programs that are probably very good, but I feel like I've been dropped in the middle of a swamp and I'm not sure where land is. And so I'm not sure how to work my way through this. Because this is going to continue for years. And I want to make sure, I'm not sure it wouldn't be better to give this amount of money to the local mental health agency or to the schools to pay for more counseling or professionals in school. I just don't feel like I know enough to make an informed decision.
So I would encourage you to go back and look at the testimony that we heard from Ashley Miller and from
When
Haley
did we
Mc-
hear that testimony?
and
'Cause,
Haley McGowan. They both have worked with pediatric.
yeah, these are the people that have the peer-to-peer counseling.
No.
No?
Let me finish, and I'll be more explicit. Haley McGowan is a pediatric psychiatrist who we heard from, who enumerated many of the issues that she is seeing and others are seeing with children right now. Ashley Miller is a medical professional in a rural part of the state, and she talked about, I think we heard about 5 different cases that she's working with
Okay.
kids and their problems and how that's exemplary of what's happening. Then we also heard from a superintendent from Franklin Northeast, which granted is a small district, but she was representing one of the larger school districts within the Champlain Valley, including the Chittenden South, the Seaview district, which is a huge district. And we heard about problems associated with kids in schools. And the overall comments that we've heard is that schools don't have the capacity to work with this and deal with this, that there needs to be something else that links with families, that links with perhaps medical professionals and so on. So that is some of the testimony that we've had. And we've also heard from others about that. I think DMH has been in, and I've asked DMH to comment on 197, which I'm hopeful they will do. And when we have Emily Hawes in, maybe we can reiterate that request. So this
Have
is,
we had anybody from the Department of Education in?
no, that I'm going to let the Education Committee deal with the AOE on this. It is going to be an iterative process within 2 committees. If you feel you'd like to hear from Deputy Commissioner Boucher, we could do that. I think she's the one who would be most appropriate, but I'm going to allow, I think I would rather, before we do that, have the Committee on Education do that.
Okay, I'm still struggling. I know there's a problem. I am struggling to figure out what's the best way to deal with the problem, what's causing the problem. There's a problem. There was a problem before the pandemic with increased violence from kids in schools. We're running out of money, and I want to make sure we get the best thing. And to me right now, I have no idea. I keep seeing ads on Front Porch Forum that there's money available for after school programs, which kind of indicates it's not being picked up. It would be helpful to see a map of where we do have after school programs, where we don't, and what are the problems, because some kids are getting something and some kids are getting nothing. And that to me would be a first priority, to make sure that everybody has access.
I think that is what we just heard from Holly Morehouse. And Holly, I'll let you respond to the last question about geographic distribution of after school. And then I will add a question for you, and this relates to Senator Cummings' concern, and that is the effectiveness of after school in
That is
you
not
know
my
what?
question,
No, it's
Jenny.
my question, Senator. I'm adding a question. I'm adding a question. I'll wait. Go ahead. You can respond to Senator Cummings.
So thank you for noticing the ads around the funding. Already the intent to apply for that $4+ million. Those requests far exceed what we have available. The ads are not out there because we're not getting requests in. They're out there to make sure that it's equitable and as many people and organizations hear about the opportunity as possible. And the ads are targeted in counties where there are fewer programs in existence. So there are some priority counties based on our analysis. We have looked at every school, elementary, middle, and high school in the state at their enrollment numbers. We have compared it to the capacity that we can research in the after-school space and the summer space, and have identified some gaps in programming there. We also do have maps of where programs are and have tried to do that extra layer, because just having a program on the map isn't quite enough, right, to get it accessed. You have to know the hours and the affordability and transportation and all those other pieces that I know you're aware of.
Can you share that map, or if it's a list?
Sure.
So,
Absolutely. Yes. And it's in the analysis of the gaps is in progress. And it's one of the things that the governor's interagency after school task force is working on as well. I do want to say, the mental health issues that our children and youth are facing, and that they are speaking about and identifying for us, and we're seeing show up in families or in ERs, is a complex problem. I don't think there's any one solution. I guess what I see is, once again, that it's an all hands on deck approach, and what can we do that is different or more, and what spaces can we utilize? I think what 197 does that is exciting and different and could lead to some different innovation, collaborations, and partnerships is really to look at that after school and summer space, and to extend, right, the resources and the opportunities that we offer. What a high quality after school program can do with training and funding. We have had a social emotional learning initiative for years, working on site to set up strategies so that children or youth are in collaboration and talking about managing emotions and managing conflict, and doing peer discussion groups where they can talk about things that they're struggling with, or things around friendships or anxieties as well. Having that caring adult who's, outside, the school or outside the classroom, who is connecting. Many times the after school program is the connection point between the school day and the family as well. Often the after school provider is the one who has that contact when a family member, is picking up a young person at the end of the day. So I think what's exciting about 197 is a chance to say, hey, let's look at that space that we know is valuable. Let's take what's really good about it and let's expand that. Let's build in those collaborations with mental health agencies, not to replace them, but actually to augment their work and pull them into these other spaces. So that's what I think is exciting about it. And that's what I think it's answering, right? Is it's not going to be the panacea that solves everything, but I think it could be a really important piece of the puzzle clicking into place that expands, flexibility and supports.
Any other questions? Senator Hooker, you were almost,
I just-
and then Senator Hardy.
If I could, yes, thank you. And thank you, Holly. The suggestion's been made that maybe this money would be better set in mental health. would mental health then be able to accommodate after school with programs such as the ones you're talking about? Or is this something that you see as kind of a direct line to the after school programs as opposed to putting money into mental health generally and hoping that it falls into your bailiwick?
I think everything that it's a both and, right? It's, everything that I am learning in a very humble way about where we are is how do we do differently and how do we do more in collaboration, right? So one of the things I like about the proposal is it's not just the Agency of Education, it's not just the Department of Health, but it's like, how do we come together in that? I think that there are things that the after school professionals know about the children and youth they're working with and those close connections to families. And there's something different that happens in that informal space, right? Where youth are interacting across grade levels and in different ways. And throughout the summer that I think would help mental health professionals make those connections, right? And help provide additional supports. I also think that the scale, to me, the scale of the issue sounds pretty big. And I think we need to think beyond individual counseling sessions, super, super critical. And there are children and youth that is exactly what they need. And they need enough of them and enough support in that space. And there are other things that we can be doing in small groups that we could be doing around, being out in nature and talking about, stress and mindfulness. There's so much more that we can reach even more youth before they get to that critical period. So what I do like about 197 is that when you look at those requirements or pieces of the grant, you can see those tiered level of supports, right? So that we can raise mental health and well-being for all children and youth, right, that are in the program. And then we can do the specialty small group work with those that are, around certain issues, whether it's eating disorders or anxiety. And then, can we also in these spaces provide, some of those one-on-one connections for the ongoing, counseling sessions. So it's a both and for me.
Okay, any other questions for Holly? Yeah, it's something different, so it makes it a little more challenging to, fully understand what it means and the extent to which it may help kids. I get that. Senator Hardy.
I don't have a question. I just wonder, I discussion on the bill. It just doesn't. We have had testimony about the mental health issues facing youth, and I know them extremely well. Believe me, I do. But we have not heard from any of the people who've testified that this is the solution, this bill. And so except for Ms. Morehouse, that's the only one we've heard from who said this. And Holly, there is no question that after school and summer programming is crucial. I know personally how crucial it is for young people who are struggling. I do. I just don't feel like this bill is going to have much of an impact on a broad group of kids at this point. And given that we're hearing dire need from our schools and their needs for school-based clinicians. Not all of our schools even have a school-based clinician, and those that do, believe me, it's hard to get in to see a school-based clinician. And then our mental health agencies, our designated agencies, are struggling right now. And so could this $250,000 fund 3 positions in mental health agencies that are really needed? And you already have the $4.25 million to expand after school and summer programming. So even though that may be insufficient, I'm just thinking about what is the biggest bang for our buck, the best use of our resources, and whether this is it. I think there's no question that this would be helpful, but is it the most helpful thing we could be doing at this point. And given that you already have the 4.25 and there are other needs that are unmet and we don't have funding for them. So that's what I'm struggling with. I think it's similar to what Senator Cummings was saying.
Yeah,
there's no
these are,
question that your work is important. That's not the issue here.
I think they're good questions that you've asked, and I think that Holly has responded about the current 4.25 million to extend and expand geographically the after-school program, but that the after-school program currently does not cover the mental health needs that we're seeing during the 2-year period that's included in the bill. So this is a temporary program. If we think about adding school counselors, that, it's a 2-year period. So anyway, here's my suggestion is this is not the final time that we're looking at the bill. We have it scheduled further, and it will also be scheduled into education going forward. And then the 250,000 is a placeholder. Maybe we should put more in there. I'm thinking that maybe I might ask Katie on my behalf to do that, but we'll see. No. So the issues that we're facing are significant, and having some broader approach to mental health issues, in addition to the one-on-one counseling that families have to seek out, or school counselors have to help families seek out. It's not an easy process, but having some additional opportunities for kids to be supported within the after-school space and within their communities makes a lot of sense. I'll also be thinking about additional testimony that might help us get to a better place in the bill. And I think that we'll work with education to do some of that. Senator Cummings.
Yeah, I'd like to hear from the Department of Education and also from the mental health agencies, our DAs, to see what they are doing and where they see the needs.
Yeah, Vermont Care Partners, I know that they currently have some one-on-one, they're giving out grants to various folks for workshops. Again, it is separate, but we'll have them come in if you'd like. Vermont Care Partners will also have, and we can get some of their local folks in, because I think that's what you said.
Okay, no, I didn't ask for Vermont Care Partners. I'd like to hear from the Department of Education.
I heard you say that.
Okay.
I'm not
from
finished
local
yet.
mental health.
I'm
Okay.
getting there. I've asked the Department of Mental Health for their input on the bill. We'll do that again. Vermont Care Partners with the DAs, we'll try and get someone in on that. Agency of Education will do that. I'm thinking that the first crack at that may better be done in the Education Committee. So, but we'll do that. We'll get all those folks in.
Yeah.
And we're going to hear that, I don't know what we're here. I have no clue what we'll hear, but I do have a clue what we'll hear. My thinking, our thinking on the bill is we have an emergency, we have a mental health crisis, and we see kids who have gone beyond mental health needs into perhaps behavioral demonstrations that are of concern. So preventing some of that is important, and then helping the kids who have, whether it's anxiety or something even stronger. We'll see what we can do. So Holly, is there anything else you'd like to add? Any thoughts you'd like to add based on the discussion that you've heard? And then we're going to move on.
I just want to thank the committee. I want to thank you for your questions. I do want to say that I think my purpose in being here today is not to really advocate for after school and summer and all that they bring, but rather to offer different time and spaces, right? So that the children and youth can get the supports they need wherever they are, and that hopefully would offer more flexibility to school-based clinicians and to mental health agencies and all those that are working in this space to connect with children, youth, and families in some alternative and additional spaces that could complement and reinforce what's happening during the school day and in private sessions. So that was my purpose. And I really appreciate all your support for after school and summer. And I hear that support and recognition of the important role that they play. Once again, really, this was about, is there something we can do differently? And there is a way that this field can help and offer some flexibility to help address what's in front of us now. So thank you so much for your questions and for your interest and for considering this issue.
All right, thank you. Greatly appreciate your time and the work that you're doing, and anything you can do to help us move forward will be greatly appreciated. Perhaps as Senate Ed looks at this, they'll also have questions, and look forward to further work with you. Thank you.
Thank you.
Okay. All right. So and so now we can go back to 195, 194, 195, and Katie is here. Aaron, is Emily Hawes here? Is she coming in?
No.
Okay, I'll have to reach out to her. All right. Katie, welcome. I think we have a new draft, and I'm going to let Senator Hooker kind of kick us off.
Thank you. As you said before, Senator Lyons, we worked with Katie yesterday to take a look at S-194 and 195 and came to the conclusion that they should be combined. In the beginning of this process, when these bills were introduced, I think I introduced them as companion bills. It seems that one really needs the other. So I'm really glad to see that we've put them together. There were some changes that we made to the original, and you'll find Katie's new draft 1.1. Is that the draft number, Katie?
It's 1.2.
1.2. Oh, okay. Yep. I copied 1.1 off last night. You've been working hard late into the night. So thank you for doing that. I'm not sure how much you want to go through, Senator Lyons. I think Katie can bring us through it much more quickly.
That's up to you, Senator. If there are any comments you want to make about any of the decisions that we made, why don't you offer what you could offer them now, or you can wait and offer them as we go through the bill?
Let's go through the bill, and I think they're better in context.
All right.
Okay. Good morning, Katie McLean, Office of Legislative Counsel. I will pull up my draft. I should let you know my internet is being particularly difficult today. So if I lose you and can't rejoin, I'll try to call in. But let's hope for the best. Okay. So here is the draft. Let me scroll to the top. I apologize. So as Senator Hooker said, this version of the bill combines S-194 and S-195. And you'll sort of see that the bills are in their original format, in that first, there's the bill on the mental health peer support specialist. And we start with the findings and go through the substance of the bill and have an appropriation. And then we'll have a transition and a reader assistance heading to let you know that we're transitioning to the respite bed bill, and then start over with findings, substance of the bill, and the appropriations. So that is how this is structured. So with regard to the mental health peer specialists, there were 5 findings and the bill is introduced, and that has not changed. Those findings are the same. Then we get to section 2 on page 2. And I should maybe pause here to let you know that the structure of the bill has changed slightly. So what is happening is that in this section, there is an agreement that DMH is entering into with a peer-run or peer-led entity to create the certification program for peer support specialists. This had been in codified law in the green books in the earlier version, but this particular set of language has been pulled out into session law because this requirement is only happening one time. You only have to create the certification program once. It's not an ongoing event. It's a one-time event. So anyway, this part of the requirements of the certification has been pulled out and separated in light of the fact that it's not an ongoing requirement. This
Is different.
language, starting on page 11, says that on or before September 1st, 2022, and I'm just going to pause to say that's an arbitrary date that I came up with when I was putting this together. So if the committee is not happy with that date, there's no magic in those numbers. On or before September 1st, the department shall enter into an agreement with a peer-run or peer-led entity to develop a statewide certification program for a peer support specialist in accordance with the guidance issued by CMS for the purpose of enabling a certified mental health peer support specialist to receive Medicaid reimbursement for the individual's services. So we've added that language in to sort of emphasize why we're going through this exercise of creating a certification program. It's about being able to receive that Medicaid reimbursement for the services that are being provided by the mental health peer support specialists. I just got a message that my internet is unstable. Can you hear me?
Yes.
Okay. So you'll see that the language that has changed is highlighted in yellow, but for the most part, we're pulling all of the language with regard to what has to be in the certification program and what this certifying group has to think about. We pulled that all out of the bill as introduced. So we have the same language about developing a curriculum, that the curriculum has to address certain core competencies, and those are listed. Language about establishing a code of ethics, determining the process and continuing education requirements, determining a process for investigating complaints and taking corrective action, determining a process for an individual who's employed as a peer support specialist on and after December 31st of 2021 to obtain a certification by passing a certification that was specifically created for this purpose. You'll notice that some of the cross references in the bill has changed. One thing I did now that we're combining the bills is that the concepts in the two bills, having peer support specialists and then these respite beds that in part are staffed by peer support specialists, it makes sense when the language that will be codified is codified, that they appear next to each other in the green books. So you'll see that some of the numbering has changed to pull those two pieces together in the green books. The two separate bills is introduced. They were sort of kind of not next to each other in the statutes. They were in the same part, but sort of separated. So this pulls those two pieces together. Next, in subsection B, we have instructions that this group that is going this peer run or peer-led entity that DMH has selected to do the work of creating the certification program. We're numbers 1 and 2 in subsection B give instructions about who this group is to consult with. So existing language in 2 is that they're seeking feedback and recommendations from peer-run and family organizations, hospitals, mental health treatment providers, and other organizations by convening not fewer than 4 stakeholder meetings. This draft includes a new subdivision 1 that directs this entity that is creating the certification program to regularly seek advice and work collaboratively with OPR, DMH, and DIVA in standing up this program.
And can I just interject here that this is a change from the initial, the original bill, but it really is in keeping with what the proponents of the bill want, is that the peer-led group or the peer-run group is the group that's sort of in charge, and they're looking for advice from mental health and the Office of Professional Regulation. This is the connection with the state that was going to be different in that we were going to look at what was already in OPR, and then it's my understanding that this group was going to sort of advise OPR, but I think this kind of puts it on its head. So, and Katie, maybe you could explain that in more understandable terms.
Oh, I thought that was great. Yeah, so I think a lot of times we see that we're asking or directing the state to do something, and then we're saying, oh, and state, please consult with these interested parties or the parties that are affected. And so this model sort of flips that on its head, and instead it's having an entity selected by DMH that's peer run and peer led taking the lead, and instead having that advice coming from the state.
Madam Chair, can I ask a question?
Go right ahead.
Okay, thanks. I don't know if this is for Katie or Senator Hooker, but this flip on its head totally makes sense. As long as that is okay with CMS, like, are they still gonna be okay and provide Medicaid, Medicare, their stamp of approval on the certification process for the purposes of Medicaid? And I know you can't speak for CMS, but does DMH and DVA feel like this would be sufficient for that process?
Do you want me to try to answer, or would you like to?
Yeah.
I don't want to cut you off. I would say that probably the best thing to do would be to pull in DVA to get confirmation if that's what you need. What we did hear in testimony was that different states go about their certification program for this purpose of Medicaid reimbursement in different ways. Some are sort of set up within an Office of Professional Regulation or within a Department of Mental Health, and others are more independent. So that suggests that this model would be a model that could be approved. Again, I think if that is a concern, that it would certainly be worthwhile to hear from folks in that department to get confirmation on that.
Yeah, and I would just confirm what Katie's saying about having heard that there are different ways that different states go about this, and I'm certainly happy to hear from DVA to make sure that they're comfortable with this.
Yeah, I would hate to have us pass a bill and then in September hear, oh, this isn't going to work. We
Right.
kind of had that situation last year on a completely different topic, but I don't want to have that happen this year and then we lose a whole year in this. So getting confirmation either from DVA or CMS themselves to come in and say, yeah, this could work. They can't guarantee anything, but this could work. That would be helpful so we don't lose.
I think, yeah, it's a good question. I think the question is of DMH or DVA, actually of DVA, is this a process that will work for them so that any model that we put forward might follow or be like a model from another state that has already received approval. I don't know whether CMS is going to be any more forthcoming, whether we want to stretch it that far. Remember, the bill also needs to go to the House, and we can talk with the House about how to that maybe this area might need improvement, but I think reaching out to DVA at this point is a good step.
And I've, in some conversations, I remember hearing that 48 other states do this, and CMS actually encourages it.
Yeah.
The certification. So I'm hoping that they would think that this is something that would be easily done. And well, not easily, nothing's ever easy, but that can be done. Thanks.
Okay, I'll keep going through the bill. So as I mentioned before, we sort of lifted this portion of the bill as introduced out of the new statutory section because it's sort of one-time language. And as a result, I had to lift some of the definitions along with it so that we have defined terms with this sort of section of session law that stands independent of the new chapter. So to do that, I said that certification, core competencies, peer-led, peer-run, peer support, and peer support specialists have the same meaning as in the chapter. And then collaborative documentation also used to be within that chapter, but that term kind of was pulled out with this new section created, so that has a standalone definition and it's no longer defined in the standalone chapter. So that is what's happening with the definitions. And then we get to this new chapter that's being created. This was in the bill as introduced. You have a purpose section. And you'll note that in the bill as introduced, the purpose was really focused on the services for the individual experiencing a mental health condition. And this language is more expansive to say, and for caregivers, parenting children, youth, or emerging adults who are experiencing a mental health challenge. So you'll see that change throughout the purpose section. And then we have definitions, which is largely the same as the version in the as introduced version. With regard to a certification, you'll notice there's a recognition that a certification could include the subspecialty of family-to-family support specialist. So that's been added on line 18, page 6. And then on page 7, there's a new definition, peer-led, and you've probably already picked up on the fact that peer-led is added throughout the last section and this section. And so this is to give them, it's a little bit more expansive. Before we were referring to an organization that was a peer-run organization. And this peer-led definition means an entity, program, or service whose executive director, chief operating officer, individual who is responsible for the day-to-day service, identifies publicly as a person with a lived experience of mental health challenges, and that the entity, program, or service operates an alternative to traditional mental health services and treatments. And that provides a little bit more of an expansive read on the language peer run, meaning that, it doesn't just have to be, that like 51% of the employees are peers. It could be that the organization is led by somebody and has a mission of working with individuals with mental health and providing peer supports. I see there is a question, Madam Chair. Would you like me to stop for that?
Yeah,
question?
if you have a question, just speak up because I can't see everybody.
Okay.
Go ahead.
Yeah. So this would mean that our designated agencies that have been running peer support crisis beds would not be able to get Medicaid funding for those beds unless now my mental health agency says 30% of their employees are peers. But unless the director wants to come out in public that they have a life challenge with mental health, and I know I'm going to get emails from Wanda, but unless
Wilda. Yeah, Wilda. Yeah.
Unless we're leaving our designated agencies out of this at a time when they are struggling to stay afloat. Is that right? This would only be for agencies whose director has a history of mental health issues?
So this language modifies the entity that that DMH can contract with to either train mental health support specialists or to run the certification program.
Okay.
So
Okay, so it's not the actual provision of service.
correct. It's modifying who can enter into this contract to provide services that will certify a mental health support specialist.
Okay, so this is setting up the certification program.
Yep.
All right.
And Madam Chair, if I may, just
Yeah, no, go ahead.
a lot of our designated agencies, actually also Senator Cummings, have peer-led programs within them. So I don't think it's necessarily leaving them out, because they have peer support specialists and peer-run programs within the DAs as
Right,
well.
but it says
So-
the director has to have a history.
or the individual responsible for day-to-day services. So I think
Okay,
that might
well-
capture, but to Katie's point, it is just for the certification. So that's important too, but
We do have mental health specialists. All right.
Okay. Let's see. So we have an update to the definition of peer support specialist. Again, that concept of including an individual with lived experience of parenting a child, youth, or emerging adult who is experiencing mental health challenge. So that conforms with the earlier change we saw in the definitions. And then we move into section 8503. And this is sort of the ongoing responsibilities of two entities to sort of manage what certification will look like going forward. So this used to be where the development of the program language was that was pulled out. Developing the program is a one-time thing. So that's in standalone session law now. But what you have remaining are sort of the two ongoing tasks that have to happen in order to operate a certification program. So in subsection A, that's determining the eligibility of an individual to pursue a peer support specialist certification. So this directs that the department, DMH, is to maintain an agreement with a peer-run or peer-led entity to determine the eligibility of each prospective peer support specialist seeking certification under the chapter. So determining before the training even starts, does the person meet the criteria? Are they the right age? Do they identify as having a lived experience, et cetera? And secondly, this entity would train applicants who have been deemed eligible with the curriculum and core competencies that were developed by the entity that DMH selected to sort of create and standardize what the certification process should be. So that is subsection A. And then in subsection B, the department is to maintain another agreement with a peer-run or peer-led entity. And that entity is to serve as the certifying entity for the peer support specialist, meaning this is the entity that's sort of operating the certification program moving forward. And then we have the requirements of what this peer-run or peer-led entity is required to do. To determine whether an applicant has met the requirements for certification that are previously established by that one-time group that's putting together the certification program. It has to adhere to the processes for certification and recertification and revocation and an appeals process that have all been previously established. And new language is that it has to maintain a public-facing website that includes at a minimum a roster of certified peer support specialists and a procedure for filing a complaint against a certified peer support specialist. So that information about who is certified is publicly available. And then
Katie,
we have.
I'm sorry to interrupt. Who maintains that website? DMH or the
No, this
program?
would be the entity that on an ongoing basis runs the certification program.
Okay.
So then we have language in 8504. This, it hasn't changed from the bill as introduced, but it also tells what what makes somebody eligible for certification. They have to be 18 years of age. They have to be self-identified as having a firsthand experience with the process of recovery from mental illness or be a family member of such an individual. Be willing to share personal experiences, agree to the code of ethics, successfully complete the curriculum and training requirements for a peer support specialist, and they have to pass a certification exam. And then to maintain their certification on an ongoing basis, this is language again from the bill is introduced, that they have to adhere to the code of ethics and sign on a biennial basis an affirmation to that effect. And then completing any required continuing education, training, and recertification requirements that are developed by the group that is responsible for creating the certification program. In 8505, this is language that was in the bill as introduced, just saying that if there are any fees needed for this program, that the certification program has to go through the process set up in statute, the fee bill process. And then we have section 4. Again, this hasn't, there has been one change, but this hasn't changed significantly from the bill is introduced. But this is directing AHS to ask CMS to amend the state's Medicaid state plan to include the certified peer support specialist as a provider type, include peer support specialist services as a Medicaid covered service, allow beneficiaries to self-refer to peer support specialist services, allow for collaborative documentation of peer support specialist services, and allow reimbursement for peer support specialist services for a range of healthcare common procedure coding system codes. And if you remember, this section had a long list of specific codes. The decision was made not to have that long specific list and instead refer to the codes generally. And I'm gonna pause here because I'm noticing that I have the word on page 11, line 14, the phrase collaborative documentation, and that I said wasn't in this section, which is why I pulled the definition out, but I'm seeing it now. So I'm going to put the definition back in this chapter. So we have a definition for that term. Okay. Oh, I'm sorry. And then there it is. I was ahead of myself. So in subsection B, we have definition section, which includes collaborative documentation and the peer support specialist definition. Next, yeah.
I'm sorry, can I ask a question about this? So this is, I know this was in the original bill, but just so I understand the process, this section would require AHS to seek approval from CMS for amending our state plan.
Yeah.
What happens if they don't get approval?
So that's sort of anticipated in the effective date section. So the section 3 taking effect is contingent on section 4 being approved.
I
if
see.
That makes sense.
Okay, so things wouldn't move forward if we didn't have the approval from CMS first?
Yes.
Okay.
Well, not with regard to the like creating the entity that will sort of start to create what the certification program will look like. That will be initiated when the bill passes. That is going to start right away. But in terms of implementing the program, and to be able to draw down a Medicaid match for those certified peer support specialists, that couldn't move forward without the state plan, the amendment for the state plan being approved by CMS.
Okay. And I know we haven't gotten to this section yet about the centers themselves, but could that move forward without CMS approval?
Yeah. That could, I mean, the understanding is without the CMS approval that the purpose that that you're looking at this language is to get the Medicaid match.
Right.
So the centers could move forward and you would have peer support specialists working there who aren't certified and who aren't drawing down the Medicaid funds. But yes, that could go on without getting the approval, just recognizing that those individuals aren't getting the match.
And does this give a deadline by which time AHS has to seek approval from CMS?
It does not.
Okay.
Go ahead, Ann.
When we're hearing from Diva, I know we're under negotiations for a new contract. I just think we could be picking up hundreds, if not more, practitioners that would be eligible for Medicaid funds. And I'd like to know, we have a ceiling and the impact on that, because we may not be able to do anything else if we do this and do it as wide open. And I think we should know that.
Yeah, that's a really important comment. So one of the questions that we haven't asked is whether we need to have any kind of rules developed by DEVA regarding peer support specialists. And, because we are pushing up against the ceiling. So we'll ask DEVA that question. And Nolan has just turned on his light. So Nolan, would you like to make a comment?
Sure. For the record, Nolan Langwell, the Joint Fiscal Office. To Senator Cummings' comment, I think DEVA, not to put words in their mouth, but they'll say, we don't know yet, because they're still negotiating. We don't know what it's going to look like. And we may not know by the end of the session. It's kind of a difficult piece for us to be trying to do things when we don't know what the world is going to look like. So it's definitely an important consideration, but I don't know that. And you could have DEVA come in and talk about it in general, but I think they may not have an answer.
Go ahead, Cheryl, Senator
But
Hooker.
it seems that the point is that either of these programs, whether it's a certification or the peer respite centers, can go ahead without the drawdown for Medicaid, but certainly that would be the optimal outcome of the bill, is to have that.
Yeah, you would be pure general fund.
Yeah.
Right, if at all. I mean, any funding would be general fund. Right now, Alyssum and Pathways, I think, receive state grants. So they could continue, and any expansion would similarly compete for funds. But opening it up fully for Medicaid reimbursement is a whole nother story. And it sounds like it's the unknown.
Or
A
even
lot
for
of what-
grants from AHS that are
Yep.
investment dollars. We just don't know.
Okay.
No answers at this time, sorry.
No answers. Thank you, Nolan, for no answers. Okay, so Katie, let's go back.
Sure.
Thank you.
Okay. Oh no, had it all queued up and it went
Oh,
back.
I know it
to the top of
happens
the
all the
bill.
time. This happened to me too.
I make it every, I feel like I'm making folks dizzy. Okay, so we were at the state plan amendment. And then the next section, section 5, is the directive for Medicaid reimbursement. This is the section that doesn't take effect until section 4, the plan amendment would be approved. So this language is contingent on approval. And this section was in the bill as introduced, but it specifies that the peer support specialist, and we're referring back to the definition, is to promote engagement, socialization, recovery, self-sufficiency, self-advocacy, development of natural supports, identification of strengths and maintenance of skills learned and other supports. Subsection B, DEVA shall reimburse peer support specialists in accordance with Vermont's Medicaid state plan. Then we have the appropriations section. Again, this hasn't changed since the bill is introduced, but in fiscal year 23, 525,000 is appropriated to AHS from the general fund for development and operation of the certification program, and the agency shall seek to maximize federal financial participation in funding these administrative costs. So this is where the bill transitions. We've so far just been looking at the certification program. You'll see on line 17, we have the reader assistance indicating, okay, we're switching topics now. We're moving to the peer operated respite centers. So next we have section 7, which is findings. The bill as introduced did have a few more findings. So you'll notice that the numbers are highlighted. That's just to let you know some of the findings from the bill as introduced have been omitted in this amendment, this proposed amendment. So for the moment, I'm going to skip over the findings. And then we have section 8, which is creating a new chapter, peer operated respite centers, which would appear in the green books right after certification. We have a legislative intent section that has not changed since the bill is introduced. A definition section. And you'll notice in the definitions, we're adding a definition of peer led. And we're just referring back to the definitions in the previous chapter, and also in the peer operated respite center, we indicate that it is staffed and operated by a peer led or peer run entity. And then we get to section 8553, which is the centers themselves. And I will maybe before we look at the language, tell you the two major changes that are happening here. So first, if you remember, there were specific counties and cities that were indicated as where the peer run or peer led respites were to be located. That specificity has been removed, and instead we're just referring to the fact that there would be 7 of these respite centers funded, and they'll be in geographically distinct locations. So you'll see that in the language. And the next thing that you'll notice, or you might remember, there in the bill is introduced, there was a pilot. The pilot was different than this language in that it was piloting a partnership between the peer operated respite centers and community centers. That pilot has been removed from the bill, but this language, the peer operated respite centers and the funding for 7 programs, says that you could have just sort of a peer operated respite center, or this could fund that partnership between the respite center and the community center. So it sort of gets rid of the pilot and incorporates the concept of the pilot here in this language. So 8553, annually, the department is to distribute funds to 7 geographically distinct peer-run or peer-led organizations to ensure a peer-operated respite center operating singly or in collaboration with a peer-run or peer-led community center is established and maintained. This in subsection B requires the department to adopt rules to address the application process for a peer-run or peer-led organization seeking to maintain and operate a peer-operated respite center operating singly or in collaboration with a peer-run or peer-led community center. That's just to be consistent with the language in A. And then the rest of this language is the bill is introduced. The other parts of this list are what the department has to adopt in rules, operational standards, annual reporting requirements. And then also in the bill is introduced this language in subsection C, which is an annual report back to the committees of jurisdiction about the activities of the peer-run respite center or the peer-operated respite centers, including challenges that may be addressed through legislative action. And section 9, we have the appropriation for this peer operated respite portion of the bill. In fiscal year 2023, 3.5 million is appropriated from the general fund to DMH for the purpose of distributing 500,000 to each of the peer operated respite centers established pursuant to this chapter. I should put it as, oh no, each peer, yeah.
And as a
Um,
reminder, oh, sorry, go ahead.
No,
Go
I
ahead.
was just
Finish
thinking
up.
out loud. I was wondering if I should add that same language here about operating singly or in collaboration with the community center, just so I'm consistent across both sections.
Probably makes sense. Cheryl, I mean, Senator Hooker, what do you think about that?
Yeah, consistency is good.
The question I had was the issue that Nolan brought up last time. We discussed this on the 500,000 and whether it's 477,000, because currently that's what the Alyssum and Pathways Solteria get. So Nolan, comments on that?
No, I think you framed it as well as I could have. It's a question just is whether you want to give these new centers that aren't created more money than the existing centers get.
Yeah.
That's all.
Yeah, I'm all for consistency.
Okay,
How do we multiply 477,000 times what? What's our
7.
number?
With a calculator.
Yeah, with a calculator. That's a big number.
So 477.
3.339.
What was it, Nolan?
3.339.
3.339. Okay, thank you.
Okay, so this is where the bill is now based on the work that's been done. As we had said, we'd like to look at them together. Now they're together. Questions? Senator Harding.
Just one quick question. Did we just change the numbers? I'm sorry, I missed that. The appropriation to 477 each.
Well, we can do that.
Oh.
The question is, would the
I
committee
like
like to
round
do?
numbers. I'm
I'm
fine with
sure you
way-
do.
But
But you
whatever.
know, consistency, I think, is also important.
Yeah.
So-
Either way is fine with me. It's going to be a battle in appropriations.
Oh,
Or you can, the other
Trust
option is you
me.
raise the other two up to 500.
Exactly. That's what I was thinking. But
Yeah, well, then we're stepping into the boots of appropriations, and I just think.
Yeah.
let's not
either way
do
is
that.
fine with me, because I think they're going to come up with the number regardless, not us. But I just want to say thank you to Senator Hooker and to Katie for all their work on this. I think it's looking really good.
Wait, don't leave me out.
And Senator Lyons, sorry. I was under the, okay. Anybody who may have worked on this, and Wilda too, who I know is listening. Thank you for all the work on this. I think it looks really good combined. I really, really appreciate that you added the language about youth and children and parents. I think we heard testimony about that, and that's super important. So I appreciate that a lot. And I like the more generic geographic language. You could put Addison County plus 7. No, I'm just kidding. I really appreciate that. And also I also appreciate the sort of integrating the community centers rather than calling it out as a pilot. I think that works better. I just want to clarify one of my questions from earlier about the sort of CMS and wanting to have DMH or DIVA actually come in and say that they are supportive of that. And I know Wilda's listening because she emailed me, so I'm just going to say it publicly. I think it's really important to get them on the record to say that they're going to do this and that they're fine with it, and that they're, seeking the CMS approval and that they think it will work, because I want to make sure that we don't get stuck in the off session with something that doesn't work and then we can't fix it. So just to have them on the record, even though I know it's been done in other states and I know it's in the CMS rules, it's just important to get our own agencies on record saying that it's okay. So that's, I just want to thank you all for your work on it. It's looking really good.
Okay, other questions? So the question is getting how to get DIVA on the record regarding the Medicaid negotiations that are going on.
That might not be Devo. You might want to hear from AHS. They're the
Yeah,
ones
I
that
think so. It'd be
That would
Jenny
be
Samuelson.
Jenny and
Yeah, we can do that.
Okay.
All right. All right. So I'm going to suggest that we leave this one here for now and take an opportunity to read through it again and consider it. And then we'll reach out to AHS and we'll get their thoughts on that certification reimbursement piece. Okay, unless there are other quick questions. All right, I think we should just at least move on to 206. I think there's an update on that one. It would be good to get through that one. So Katie, there's a new draft. I know Ruth, you've worked on that. So what is the new part of 206, the Alzheimer's bill we've been working on?
Trying to see if the website's been updated. So it's 6.2 now.
Yeah, make sure you have 6.2.
I
Yeah.
can't believe it's 6.2. I think that's the most.
Ugh. And I made an additional change this morning on it that I did email you, that you were on the floor, which makes it look like a big change happening, but it's sort of technical. So let's see, I'll share my screen.
Page 8,
Um,
that's where
Could be.
all the yellow is, yeah.
yeah. So I'll talk you through what's happening there. It is technical, but it takes a lot of, page space up. So version 6.2, section 1, if you recall, the first two sections were looking at the state plan on aging and how to incorporate Alzheimer's disease and related disorders into that planning that is already taking place. But first, in section 1, this is the Commission on Alzheimer's Disease, and this is included in part because this language asks the commission to weigh in on the state plan on aging now that it will incorporate Alzheimer's disease. The first section to come up is the membership. So in subsection B, the commission is composed of 20 as opposed to 21 members because this proposed language includes the executive director of the Blueprint for Health or the designee. And then in terms of members appointed by the governor, a member representing the business community is removed, and what's being added is a hospital and in addition to nursing home managers, which is what is in the existing law. And then on page 2, there's some specification about the expertise and experience that the members appointed by the governor have to have. The members appointed by the governor are to have direct expertise or experience working with or caring for individuals impacted by Alzheimer's disease and related disorders. Expertise in clinical and medical research on Alzheimer's disease and related disorders, or knowledge of health systems and policies to equitably address Alzheimer's disease and related disorders. And in subsection F, this is what I was alluding to before. Oops, nope. I'm sorry, it wasn't what I was alluding to before. In subdivision F3, this is removing the language about rules that were adopted a long time ago. So we're getting rid of that sentence. And then in subdivision F, there's new language that one of the duties of the commission is to advise and provide written comments to the Departments of Health and Dale regarding the development of the state plan on aging as it relates to Alzheimer's disease and dementia and other relevant plans. And then, so that was the commission's charge. And then we move to section 2, which is the state plan on aging. And this section, we have language in the lead-in language that sort of lays the framework for all of the specific requirements to come, that says the state plan on aging shall describe a comprehensive and coordinated system of care services, supports, and protections for older Vermonters, including individuals with Alzheimer's disease and related disorders. So this is sort of the lens through which all the other work is happening in this plan. And then there is the plan itself. And then in subsection C, this is specificity around getting feedback on the plan. So at least 60 days prior to adopting the plan, the commissioner is to submit the draft to the department's advisory board, meaning Dale's advisory board. And the new language is that the draft goes to the Commission on Alzheimer's Disease for advice and recommendations, and that the board and the commission are to provide the commissioner with written comments on the proposed plan. In subsection D, the commissioner is authorized to make annual revisions to the plan, and the commissioners to submit any proposed revisions to the department's advisory board to the Commission on Alzheimer's Disease and Related Disorders. And then we have a new subsection F, which is specific to Alzheimer's disease. So with regard to Alzheimer's disease and related disorders, the state plan on aging shall address first home-based care or placements in hospital and long-term care placements and transitions to and from care in home, hospital, and long-term care settings, support and education for families and caregivers, and strategies to promote affordable and accessible long-term care and home and community-based services to individuals with Alzheimer's disease and related disorders. So I should just pause here and remind you, I know we've talked about this previously, but the plan, the state plan on aging that is set to begin in 2023 is already in development. And the testimony you heard was that to incorporate Alzheimer's into the state planning aging for the 2023 plan at this date would be a significant body of work. So what's happening is that this section 2 that we just went over that incorporates Alzheimer's disease into the plan does not take effect until January 1, 2023, after the plan has already been adopted, meaning that this requirement wouldn't be required until the next iteration of the plan. To substitute that, because the plan will not incorporate that, the bill includes section 3, which directs that in preparing the state plan on aging that's in effect from 2023 to 2026, Dale is to include as an addendum to the state plan on aging, the state plan on Alzheimer's disease and healthy aging, which the health department is working on. And if I'm correctly remembering, I think it was going to be released or published around May, the spring of 2022. So that would be an addendum on this coming state plan on aging. Okay, so next, section 4 looks like a lot of changes, but let me describe for you what's happening. So the last time you saw this section creates, has a section about a public education resource, and it also has language about creating a coordinator. The version you last saw created a standalone chapter with these 2 sections. However, you decided to pull out the coordinator language and replace it with sort of language that asks the departments of health and Dale to work together to sort of propose how a joint position would work, meaning that's no longer codified law, that's one-time session law. It seemed really silly to create a chapter to put one section on education resources in. So what I have done is add that new section on public resources to the chapter on older Vermonters. It's not a perfect solution because not everybody who has Alzheimer's is considered an older Vermonter, but there is sort of a nexus in my mind, at least, because the state plan on aging now incorporates Alzheimer's disease. So I went ahead and did that. And then, talking with Jen Carby a bit, who worked on the Older Vermonters Act. She was really thinking that that act was sort of a standalone kind of cohesive unit. So what we decided on was to rename the chapter Supports for Older Vermonters, and within that create 2 subchapters. One subchapter on older Vermonters, one subchapter called the Older Vermonters Act that would contain the same language that's in the chapter now, except it would just be confined to a subchapter, and then create a second subchapter to put this public education resources piece in. And that subchapter will be there to grow in the future. And because we have this more expansive chapter, I don't know, Jen and I were thinking that it gives us room to grow that depending on future committees' interests in that topic. So this is all to say, this is sort of a lot of technical moving things around, but I had to go in and create a new subchapter, and then everywhere in the existing chapter where it refers to, as used in this chapter or pursuant to this chapter, I had to change it to subchapter because it's now all in a subchapter. So all of this highlighted language, all that we're doing is changing the word chapter to subchapter. And you'll see right here, this could be a place where it might be a little confusing. 6206. This is the state plan on aging. We've already amended it to add Alzheimer's disease in, but that doesn't take effect until January 1, 2023, as we noted. So this amends it just to update the chapter to subchapter, so it takes effect July 1, 2022 with the rest of that subchapter. So all of those conforming chapter to subchapter changes happen at the same time. Okay. So then we get to the new subchapter I've created, supports for individuals with Alzheimer's disease and related disorders. And the language itself has not changed since the last time you've looked at it, even though there is a long explanation needed for how we got here. So this language directs that the Departments of Health and Dale shall jointly develop and maintain easily accessible electronic, print, and in-person public education materials and programs on Alzheimer's disease and related disorders that shall serve as a resource for patients, families, and caregivers and healthcare providers. And the department shall include information about the state plan on aging, as well as resources and programs for prevention, care, and support for individuals, families, and communities. And then we've pulled out the language about a coordinator position. It's no longer as part of a codified chapter. It's now session law, because this language now directs that on or before December 15th of this year, the 2 departments are to submit a plan to the committees of jurisdiction to fund a permanent Alzheimer's disease coordinator position to be shared between the departments for the purpose of planning, public education, and coordination, as informed by recommendations of the commission, the state plan on aging, and other relevant statewide plans on Alzheimer's disease and related disorders.
So Katie,
Ruth, did you want to comment on that? I know there was some controversy around it, but it looks like it's been resolved.
Yeah, so we discussed on Friday, this language previously was to create this position and fund it in this bill. And we had a lot of conversation about whether that would hold the bill up down the hall and et cetera. Well, in the interim, I learned that there's actually a federal position right now that lasts through FY23. So it is actually funded for next fiscal year using federal dollars through their, I believe, the BOLD grant or one of the grants they have. And so it's not a permanent position. So this would request that they come back for a plan for a permanent position, but at least for the next fiscal year, they should be set. And this seemed like a good sort of interim solution to that. And the departments, in my conversations with them, asked for a shared position because they thought it worked best for their planning and their support system. So this is at their request that it be a shared position. And so this sort of helps move the bill without having it go down to appropriations.
Well, the other issue that was raised, I think, is that shared positions aren't the usual ask, but it's either housed in one department or another. But I think this really allows for that discussion to take place administratively if it's going to happen. So it's a good resolution.
Yes, absolutely.
Yeah.
Can I, Madam Chair? if
Yeah,
I
go right ahead.
Senator Hardy, if there was any indication that there wouldn't be a gap between the end of the grant and the implementation of the permanent position, can we say that?
It sounds like the grant actually goes a little bit beyond the state fiscal year by a couple months. So that would give them kind of a buffer time period to have us pass the budget next year. So assuming we put money in for it next year, or maybe for them to get another federal grant, because they could come back and say, actually, we got another federal grant and we'll take care of the position as well. But it sounds like the federal grant goes through September of 2023, I believe. So there would be a buffer.
Okay.
And now, it's very possible that the work that's going on is seen as critical, that there are other grant monies or found monies that might carry the position forward. So, I don't think it's something to get too concerned about at this point. Other questions right here? I mean, just speak up. Okay. Katie, back to you.
Okay. So next we come to the educational opportunity section. This has not changed since you've last seen it. This requires the chair of the commission to appoint a subset of commission members to make recommendations to achieve a dementia-capable workforce and promote and expand opportunities for healthcare and human services providers and first responders to improve the diagnosis, treatment, and care of individuals with Alzheimer's disease and related disorders, and to support their families and caregivers. And then this says, in developing the recommendations, the group is to consult with relevant stakeholders, including licensing entities related to specific professions. The small group is to submit findings to the larger group, and the larger group, if it approves those findings, would submit them to the General Assembly for consideration on January 15th, 2024. And then we have the effective dates. So the act itself takes effect July 1, 2022, except that the Section 2, the State Plan on Aging, wouldn't take effect until January 1, 2023. So that layer of adding Alzheimer's disease to the State Plan on Aging wouldn't be required for the next iteration of the plan that takes effect January 1, 2023. And then the title of the bill is updated to an act relating to planning and support for individuals and families impacted by Alzheimer's disease and related disorders.
Questions? Okay. So committee, the bill, it looks like the bill has been radically improved, and that's a good thing. And it'd be great to try to move it forward. I'm thinking that we should give ourselves a day with this bill because it's a new iteration, new draft. And then perhaps I'm trying to I'm looking at our calendar is pretty full, but I think that we can find some time for a vote. Should the committee wish to do that tomorrow morning, I think we'll have time to do that. So I think that makes sense. All right.
Is Katie, you're going to be here tomorrow for something, right? So Katie's going to be here.
She is.
Yeah.
Right. So we'll please review that bill one more time. And then when we come back tomorrow, we'll look forward to a motion. And perhaps Josh will be back by then and he can also vote. That would be helpful. And the other thing I would ask you to do is to read through 197 again, and just remind you that in the development of that bill, there were many meetings with various folks, including Department of Mental Health and others. So we will come back to that, and we will get some of the folks either in or to provide written testimony regarding the questions that we've heard there. And then we'll come back to that, not right away. We'll be back to that, I think, where did we put it? Not for a while. Okay. All right. So then, that's it. I think the big news, of course, is that tomorrow morning we're meeting at 8:30 in the morning. Sorry. We'll do that for the next couple of weeks, and I'll go back to our better schedule of 9 a.m. But tomorrow we're hearing first thing on S72, which is a bill we have not looked at as yet. And it is a bill that the commissioner of DCF indicated his interest in and had asked us to look at it early on. And so this is a good time for us to pick it up and look at it. It is not all new. There's some updates to the current interstate compact for the placement of children. So, Aaron, is Michelle Childs available tomorrow coming in on that bill? We'll find out.
I'm not sure. One second.
Okay, we'll sort that one out, but she is the ledge counsel for that bill in case you're had an interest. All right, and then Jen has sent out the draft of S285 that we have worked very hard on, and I can happy to share with you the folks that I've met with to put that together, and it's based on the conversation that we've had in committee, based on testimony that we've heard in committee, and we'll go through the bill, and then we'll move on to S90 tomorrow. So just please take a minute to read through the bills that are coming up. I know it's another added layer of work, but I think it's really important given where we are in this session. All right. We have 4 minutes. Okay. Nolan, do we need to hear from you at all on anything?
Not that I know of.
Okay. All right. So I think what we'll do